So the next speaker is Dr. Thomas Arun Varghese. He is a senior consultant working at St. Joseph's Hospital, Kanjirapalli, Alphonse Eye Hospital, Pala, Jacobs Eye Hospital, Ernakulam, and Vettam Eye Hospital, Perimpalli. Over to you, sir.
Good afternoon, ladies and gentlemen. At the outset, I would thank KSOS Trishti 2025 organizers and Dr. Anjana Nair for giving me this opportunity. As previous speakers have spoken about the nuances of pediatric refraction, and I'd like to now speak to you briefly about how we can guide our parents and help them in choosing the right specs, right frame and lenses for their children. So this is the usual gadgets that we use in the case of adults. Of course, we look at the comfort and fit, the frame material, and you can, with this new gadgets like the Opticom pad, you can get multiple measurements which can help you in choosing the ideal frame. But when it comes to pediatric, they are not very useful. Our children, as especially Rosemary had mentioned, the face structure, the size of the head, temple, and especially the shape of the nose in the case of certain children, the abnormalities, all these can affect the ideal frame that they can use. And of course, if they are not comfortable, they are not going to wear it, and you're not going to get the compliance that you desire. So a child's face is not just like a zoomed in adult's face. The various differences: one is the reduced crest height, the widened splay angle, the larger frontal angle, the smaller bridge projection, small head and temple width, and of course you don't use a pantoscopic tilt usually in children. So dispensing frames, of course, when it comes to the facial and nasal structure, what is usually preferred is a saddle bridge type of nose, a type of saddle bridge in the frame, and also you need to ensure that there is a snug fit and that the frame doesn't come loose. We can use the riding bow, you can use a skull type of leg, and also you can nowadays you have these straps which can be used, which can be adjustable to ensure that the specs sits comfortably without being too tight or loose. A middle level bridge is better, and it should be a comfortable fit for the child, not restricting their daily activities. Of course, it should be fairly resistant to any hits and bumps. As you know, children are running around, and it should be an attractive color and design. And nowadays, you know, children have their desires, and if they're not happy, they're not going to wear it. Online, you see especially teenagers buying these large frames, and this is definitely not suitable in the case of our small patients. The benefits nowadays, we have these for small children, you have these wonderful frames, and they are very flexible, very light, comfortable, and also aesthetically appealing, and there's very minimal metal that is used, and the joints are very flexible. Recently, I gave a prescription to a 6-year-old child, and the child was very good with the glasses, and the mother especially was very happy, because what we don't realize is very often they have younger siblings, and sometimes the younger sibling just takes the spectacles and then runs off and does all sorts of things with the spectacle, and the mother was very happy that it was still not broken and still in one piece. So the saddle, the silicone nose piece, all are very important. You can see this is a particular company. You can see the advertisement itself shows that the spectacles are very flexible and practically unbreakable. And of course, you also have the adjustable strap that can be used to ensure a snug fit. So now we have found the ideal frame. Coming to the lenses, of course, they have to be impact resistant, lightweight, and nowadays most have very good optics. It is good to give UV protection as well. And the different materials that we have now available is CR39, poly, and MR series. And in case you have to give bifocals, especially for children with accommodative squint, then you can, when we have to give bifocals, make sure that it is not like in an adult bifocal segment, where the near segment should be a large segment in the case of pediatric patients. And where necessary, you should use a high index lenses to make sure that it is light and aesthetically appealing and comfortable to the child. Care of spectacles. Now they've chosen the spectacles and the frame. You should, from the beginning itself, you should educate them about the use of the spectacles in a good way, so that it lasts. So removal of the spectacles, you can see, tell them not to remove with one hand, always use both hands to remove the spectacles. And sometimes you see children, even my younger daughter who used to wear glasses, she tends to just throw them away. Sometimes they sleep with the glasses on, all sorts of things that they do. So make sure when they take them off, preferably put them back in the case, all simple things, and not put them with the lens touching the surface, causing damage. And especially in the case of our children with astigmatism, whenever when you review them, make sure you just check the frame, and this is what is known as the 4-point touch test. So you put the frame down as you see in the right side picture, and making sure these 4 points are touching on the surface, and that shows that the frame is in good condition. Especially in the case of astigmatism, as you know, the power may be correct, but any sort of misalignment can cause symptoms and also affect the quality of vision. So it's very nice to see that nowadays children have so much choice of spectacle frames. Also, coming to the care of the lenses, preferably wash them in running water, and also you can use these different sprays that are now available, and also microfiber cloth. I was just looking on the net, and there's this new thing that is seen. It's again made of microfiber, which again can be used to clean the lenses. So it's a very a simple topic, but a very important topic as well. So you can see the essential points should be a nice functional frame, appropriate safe lenses, and advise them on how to care for them. You can see this wonderful frames that are now available. And I started wearing glasses when I was in 5th standard, and I was, you could say, partially hyperactive child running around. I was in a boarding school, and the first 3 months I broke 3 frames. So my parents got me this big frame, you can see here, very thick, so that I couldn't possibly break them unless I really tried very hard. Thank you.
Thank you so much, sir. Even though it's very difficult for me to think you as a very hyperactive child, because you're very polite and poised. I can't imagine like that. But to be very frank, the topic was very well discussed. Lot of practical